My name's Craig Dillon. I'm director of the Microsoft Technology Center in Cambridge, and I'm here with my colleague.
I'm Clifford. I manage the healthcare team for the provider industry for the US.
The way we look at this is if we could, and I'm going to share some of the capabilities that we're thinking about, that we're actively working on actually across children's partners, hospitals, Dartmouth-Hitchcock, across Northeast, really innovating. I'm going to share some of the capabilities really that's doing that. And I think one of the really interesting things is the speed at which things are now happening. Things that took many months are now being hacked and functional in a matter of weeks. And for us and our team, we work with providers in the space. We work with across the Boston Scientifics of the world, but other companies as well as pharma, and we're sort of applying these patterns across the board. So if we had a service that could really analyze and provide key insights, because that's what we're seeing. How do you visualize and make all of what we're doing across, whether it's the patterns we're looking for, populations we're looking for, but how do you provide those key insights? And the tools that are available now that are just really turnkey are as extraordinary. So when we think about, when we put together solutions and those capabilities, whether it's around big data and Hadoop or stream analytics. So if I want to see maybe there's an event that is unusual, that we want to be called out real time, how do we do that? But not just over a little bit of data, but massive amounts of data. Machine learning. It is our company's goal to democratize machine learning. The machine learning research team actually happens to live on our Cambridge campus. The things that we are doing there is extraordinary.
I'll give an example when you've gone through all the episodes of what we're doing at Dartmouth-Hitchcock.
But you think about the breadth, search, looking for unstructured data, tying data together. Cortana Analytics is something that if you don't know the technology, how do you tie everything together and look for things? So again, storage, there's so much information out there. How do you make it easily available to all these devices that are pumping out just lots and lots of data? We look at, you want to get that data to somewhere in a structured, smart way, but you queue it up and just have it there. You don't care, put it in that queue. You think about putting it into a file system, that takes a little more time, but these things are sort of, you can just paste and put these things together, and there's traditional, SQL stores where you put more structured, columnar data, but, putting all of these things together, stitching them together in a solution, these are all just capabilities that are, available on demand. Ingesting all this data. I have a band. Microsoft Research is actually working on a very healthcare specific higher end band right now. But there's all sorts of different events going out. So how do you control those? You're making services or capabilities to turn on around event hubs, more structured conversations between systems. You can have things like what we call BizTalk services. You have on-premise data that lives within a hospital or that lives on the outside. How do you bring those together? There's so much information. We worked with a vacuum company. There's going to be a company where all your vacuums can collect data across the world, as an example at the time. Okay, visualize. The ability to visualize insights, analytics. What was there 2 years ago and what's there today? Dramatically different. The ability to do it on a mobile device at an instant and the same way that you did it for a screen. Again, alerts. All of these systems are about how do you get the data to a place, how do you quickly make it intelligent, and how do you get it out to the right person? And I think about that in a clinical environment. I sort of did a summary of all of these capabilities, but these are the things we're going to be looking at.
So let me give you an example.
Yeah, example.
So I thought I'd just give you quickly, and I know we're going to run out of time, 2 examples that are happening, which I'd love to see teams here from the hackathon take and extend. So the first one is Dartmouth Hitchcock. They have something called Imagine Care. You can go out and look it up on the web today. You'll find a few videos about it. What it does, it takes data from their Epic EHR and sensor data, like the band. They have 30,000 bands that have been deployed to patients. And what they're doing is bringing that data together, using machine learning to develop insights into that data, and trying to predict likely readmissions, likely failures, so that they can avoid them. And obviously, everyone is incredibly incented today with the new ways of paying. When we start to eliminate the pay for a service and we start bundle payments, as is happening, they're very incented to want to find to predict the likely outcomes before they happen and avoid them, like readmissions. That's an outpatient setting, and I wanted that to be clear. The other is an inpatient setting. At Johns Hopkins, they have a project called Emerge. It's the Armstrong Institute at Johns Hopkins. Great organization doing lots of great work around harms and risks in the hospital. And in their ICU, in their surgical ICU, they have taken device data. So examples, as I mentioned to Michael on a call a few weeks ago, I'd love to see companies like Stryker, the bed company, involved, because the bed has become a smart device. And they can use that bed to predict likely harms before they happen in the ICU and avoid them. And they have ways in both these examples of visualizing the data. That's an area that really needs development. But in the case of Johns Hopkins, they visualized it in a visual form on a computer. In the case of Dartmouth Hitchcock, they use Cortana Analytics. And Cortana Analytics, much like Siri, has a voice interface. So nurse care coordinators are saying to a machine, tell me what are the likely reasons for readmission. Does this patient have a risk of readmission? And they're getting a verbal response back. And so they're able to deal with it. So how do we do this? How can Microsoft help? And maybe you should explain what you do here at MTC.
I know I'm off, I'm in. By the way, all those services are all HIPAA compliant. We have a team that basically works with our company's organizations, and we design and build these things and prototype them real time. So that's what we do, and we're a resource actually for you here in this area, generally at no cost. So it's an investment that Microsoft has made.
Yeah, so this is the Microsoft Technology Center. It's here. We've also got the Nerd Center here, and we'd love to see teams after the hackathon coming out and continuing to work on these projects. So thanks very much.
Thank you for your time.